Now you heard the little click there in Margaret's finger. You can, if you want, just gently pull on the fingers. Sometimes they'll click, sometimes they won't. It's not a forced, I'm not tugging on the finger to try and click it. It's just as you stretch the finger, it may or it may not click. It's not a problem if it does, it's not a problem if it doesn't. I'm then going to come to work on the back of the hand. Now the skin on the back of the hand is a little thinner and it can be a little drier, so I'm just going to use a little cream here. You can use oil, you can use hand cream, you can use whatever it is that you normally use in your massage. But what I want to do is just lubricate the skin a little bit so that I'm not dragging the skin as I'm working. So we're now working up in between each of the bones, and these are quite easy bones to feel. You're not putting a lot of pressure on because there's not a lot of muscle there. You're just making sure that there's a clean run in between. Occasionally you'll get a client where you get to about here and you can't go any further. That's just their physiology. Just work with that and just smooth out the rest. You can see how the lotion is important because I don't want to actually pull the more delicate skin. You'll find it quite tricky if you use an oil or a cream on the fingers because you'll find your fingers will slip too much. The exception is if you're working with a very elderly client where the skin is thin, and then I would recommend always using a cream or a lotion just to help lubricate the skin because you don't want to damage the skin at all. So we've worked the fingers, we've worked the side of the hand, we've worked the palm of the hand, and we've worked the back of the hand. So next we come to the wrist.